Good morning everyone. I am Dr. Lakshmi Krishna, Consultant Neurologist, Manipal Hospital Sarjapur Road. Today I am here to give a talk about Parkinson's disease. Parkinson's disease is a movement disorder due to degeneration of dopamine producing cells in the brain. It is the second most common neurodegenerative disease after Alzheimer's disease. Dopamine is a chemical neurotransmitter that is produced by the brain cells so that they can communicate with each other for movement and coordination of the body. So when dopamine is lacking in the brain signals will tells our body how to move is lost. I choose this month, especially April, to give a talk about Parkinson's disease. Why? Because April is considered the Parkinson's Awareness Month and April 11th is the World Parkinson's Disease Day. 2023, the theme is Take 6 for PD. That means every 6 minutes, one patient is diagnosed with Parkinson's disease in this world. So that is the burden of Parkinson's disease. In this talk, I aim to introduce you to the causes of Parkinson's disease, the symptoms, how to diagnose Parkinson's disease, and the treatment options available for Parkinson's disease. Parkinson's disease, there are two types of symptoms, that is motor symptoms and non-motor symptoms. Motor symptoms of Parkinson's disease is remembered by the mnemonic TRAP. TRAP, T for tremor, R for rigidity, A for akinesia, and P for postural instability. Tremor means shaking of the body, that is shaking of the hands, legs, and even the neck. R, rigidity, is stiffness of the body, which can also involve the neck, legs, and hands, which can impair the day-to-day activities of a patient. A is for akinesia, otherwise known as slowness of activities. The patient will be having difficulty even to getting up from a chair, day-to-day activities. His gait, walking pattern will change. He will have a stooped posture. He will flex and he will take short shuffling steps. And the last symptom is P, which means postural instability. That means the patient will be having issues with balance and coordination. So he can have history of recurrent falls. So these are the motor symptoms of Parkinson's disease. Next, coming to the non-motor symptoms of Parkinson's disease. That includes constipation, urinary urgency and frequency, sexual dysfunction, dream enactment, that is acting violent behavior during sleep, depression, anxiety, and even loss of smell is a non-motor symptom in Parkinson's disease. The importance of non-motor symptom is because it can even precede a decade, 10 years before the diagnosis of Parkinson's disease. And these are the most troublesome symptoms for Parkinson's disease. Parkinson's disease is caused by a combination of genetic and environmental factors. More than 80% of patients with Parkinson's disease is due to sporadic. Sporadic means in that family, there will not be any other person with Parkinson's disease. Less than 20% is due to genetic causes. In this context, I would like to tell you one thing is that genetic and environmental factors combine together to cause Parkinson's disease. That means a patient with genetic mutation for Parkinson's disease need not get Parkinson's disease. It just increases the vulnerability of that patient and make him more susceptible for the so-called environmental factors. These includes exposure to toxic chemicals like pesticides, previous history of severe head trauma, brain fever or encephalitis in the past, family history of Parkinson's disease, well-water drinking and rural living. These are the established risk factors for causing Parkinson's disease. So to conclude, with effective treatment and supportive therapies, we can definitely improve the quality of life of patients living with Parkinson's disease. We, the medical care team of Manipal Hospital, is there with you throughout your journey with Parkinson's disease to improve the quality of life and to lead a normal living. Thank you for your patient listening.